Hello, everyone. Thank you very much for joining us for this LinkedIn live session. My name's Damien Mair. I'm Chief Development Officer at MyData-TRUST, and I'm also a certified DPO, so supporting some of our life science clients. I'm joined today by my colleague, Ed. Ed, I'll let you introduce yourself.
Hi, everyone. Very happy to be here to discuss once again the forthcoming changes to data protection framework in the United Kingdom. I'm the Associate Entity Director of MDT in the UK. I'm also a certified DPO and a Fellow of Information Privacy with the IAPP. Today's seminar, I don't want to say seminar, today's LinkedIn Live is on the forthcoming data use and access bill, which is in essence the first time that we're going to see a real divergence from the UK GDPR and the GDPR. Up until now, following on from Brexit, what we had was in essence the GDPR replicated within the United Kingdom. For all intents and purposes, there was not much of a difference between the UK GDPR and the GDPR. Most of the legislative changes following Brexit were in essence replacing the European Commission with the Minister of State, Secretary of State, and replacing regulators with the Information Commissioner's Office. So for all intents and purposes, the UK GDPR and the GDPR were virtually identical. And if you had a privacy compliant policy that was working in Europe, you were almost guaranteed to have one that was compliant within the United Kingdom and vice versa. So today we're going to actually discuss why this marks a kind of a significant divergence. And our discussion will basically cover the legislative process in the United Kingdom, because we're well aware that not everyone connected is going to be from the UK and they're not going to know the peculiarities of the legislative process in the UK. Why the prior changes were kind of cancelled or failed to get any traction and go ahead, the forthcoming data use and access bill and how it contrasted with the prior DPDI bill, and then the notable changes which concern research, which of course is the most interesting to us. We'll also discuss in brief the proposed changes or the proposed kind of standards for information and health care. And then moving on to an empowered ICO, which is the regulator in the United Kingdom. And then finally concluding with the UK EU adequacy decision and whether it is under threat or not. On that point, you might get a differing opinion from myself and Damien, but we'll do our best to maybe not provide a balanced view, each of us, but on the balance of both the reviews, it should be kind of an equal kind of foretelling. It is all, of course, hypothetical, and we can't predict what the European Commission will do. So moving on to the next slide, please. Yeah, perfect. So the data protection framework in the United Kingdom is made up of several different pieces of legislation. We have the UK GDPR, which up until now was basically the GDPR. Just to give a kind of context as to how regulations derived from Europe actually take place. So when the UK was part of Europe, you had two different types of legislation. One was a regulation and the other was a directive. When the European Union brought in a directive, countries were given kind of the autonomy as to the level how they would implement this standard imposed by Europe. The regulations, on the other hand, had direct effect, and they imposed a very base minimum standard that countries could not adapt or adjust in any way to lessen the burden. Which then brings us to the Data Protection Act 2018. The Data Protection Act 2018 was the UK's mechanism of bringing the minimum level of the GDPR and adding on the areas where the member states of the EU were able to give extra clarity or give an approach that was distinct to that member state. So it was never a lessening of the standards, but more so giving national peculiarities or national standards to areas that certain countries felt were more important to their citizens and to their national interests. Then we have the Data Protection Charges and Information Regulation 2018. This is unique in Europe, and following Brexit, unique still. This, in essence, was giving the regulator the power to collect fees from any data controller that processed or managed information collected in the United Kingdom. This is something that we run into quite frequently with clients and with pharmaceutical companies who are conducting a study in the UK. It could be a phase 0 study with, let's say, 20 members, and then suddenly ICO is turning around and saying, pay us money. Now, depending on the scale of your company and depending on what level of kind of commercialization, when you've gone for market authorization, the fee could be quite small. If you're at tier 3, approximately £40, although it's just been adjusted recently at the start of this year, all the way up to £2,900 for a tier 1 company, which is, let's say, a pharmaceutical company that has reached commercialization. This was an annual fee paid annually to ICO, and we'll probably discuss later on how they put that money to good use. The fourth piece of regulation then is brand new. It was enacted at the start of last week, or this week. It was enacted in March 2025, which is the Online Safety Act. It's tangential to data protection, but there is serious repercussions on privacy due to this act. In essence, the Online Safety Act does, as its name suggests, is tries to regulate and control the internet, primarily to reduce sources of terrorism and any kind of communication with regards to terrorism or things that will pose a harmful kind of risk to society, and also protect children's interests online. The contentious aspects of the Online Safety Bill, however, are the powers that were bestowed upon Ofcom, which in essence allow Ofcom to have a snoopers charter and to enforce proactive monitoring on social media, but also on any private communication networks, as long as they're used by sufficient numbers of UK residents. So in essence, that would mean that Ofcom could instruct Meta, the owner of WhatsApp, so Facebook, WhatsApp, Instagram, to use proactive technologies, which will be AI kind of scanning for keywords, key images, things like this, to monitor any communication between any group chats, in between private individuals, and so on. They do have certain limitations and protections put into place to try and mitigate the overstep of the authority. But as we have seen in the past in numerous instances, once the authorities have been given a power, they tend to stretch and kind of toe the line ever so more throughout, until finally they have full access to everything. Then the next piece of legislation is what we are discussing today, the Data Use and Access Bill 2025. And finally, the Information Commissioner's Office, which is the regulator which will govern everything in this. The Data Use and Access Bill will also actually change the Information Commissioner's Office and it'll become a corporate body similar to Ofcom, and no longer will we have the Information Commissioner, John Edwards, but rather we'll have a C-level body with various members who form an executive to follow the instructions of the Secretary of State. You may have seen that I flippantly put number 6, the ICO charges fees, as opposed to doing anything else, but I think we'll discuss that in a bit later on as well. I'm not sure, Damien, if you had any thoughts or any kind of things that you felt stuck out there from the legislation, or whether you thought there was any other kind of things from the framework that we should be aware of. Do you think anything perhaps from the HRA or from non-regulator sources impact data protection for pharmaceutical companies?
Yeah, I think the HRA is a good example, actually, for those of you that don't know, the Health Research Authority in the UK. It sets template language that companies conducting trials are expected to use. Certainly, if you want to get your ethics approval, you will need to be using this language or another language approved by the HRA. It's not great language. It's an attempt at standardization. It doesn't meet the criteria of the current UK GDPR requirements. And so there's a little bit of an issue there in that the sponsor, the controller, has been forced to use certain language, but which is not compliant, and ultimately the controller will be responsible if there is an issue identified as a result of, say, an ICO inspection. Having said that, the risk is is quite low, as it's the ICO, and we'll get to talking about the ICO a little bit more as we move on. We've made a couple of tongue-in-cheek comments, so you can probably assume at this point what our view on the ICO is. The other one I was going to briefly mention, but not to go into detail, is the PECR, so the Electronic Communications legislation. If you're involved in marketing and calls and things like that, that would play a part, and there is a privacy aspect to that, but it's outside of what we're looking at today.
Yeah, no, fully agree with regards to the HRA and their templates. We actually did recently have some communication with ICO where the ICO admitted that the HRA didn't even deign to submit their own GDPR wording to the privacy regulator to see if it was appropriate or not. So when your own government departments aren't really collaborating or kind of giving any credence to what the regulator says, then that kind of sometimes might lead private companies and the general populace to also question what's the function of the regulator and what are they actually achieving with their current powers. The data use and access bill, however, does try to remediate that, so we'll discuss that shortly. Just before we get into actually discussing the data use and access bill in detail, I'd like to quickly run over the legislative process in the UK and just give you an idea how we get to a law from a bill. How do we finally get an enacted act? So typically when we're discussing an act, you can get them from either a private member's bill or from one that is sponsored by a political party, and they typically kick off in the House of Commons before going to the House of Lords for their final approval and revisions. If the House of Lords, or if it happens in the inverse, if the final house has some serious issues with the bill and they suggest several kind of recommendations for alteration, they get ping-ponged back and forth, and the review process can be quite lengthy. That happened with the previous bill quite a bit, and it actually went through 2 parliaments before finally collapsing and failing to be enacted. However, with the data use and access bill, this was somewhat a part of Labour's manifesto. There's a constitutional convention in the United Kingdom, which is a peculiarity because the UK doesn't have a written constitution in the first place. But there is a constitutional convention, which means that if a party is elected with a specific law referenced or kind of given credence in their own party manifesto, once it gets to the second house, it really can't be changed or amended or opposed in any way, because it's seen as having the backing of the populace of the party who won the prior election. The Labour Party in the United Kingdom just recently won quite a large mandate to bring about their changes, and one of those changes was the provision of smart sharing and smart data and enhanced research. So while it didn't really refer to the data use and access bill in specifics, it did lay out the kind of foundation stones for which Labour did envision this bill taking place. The bill then was kicked off in the House of Lords, which was quite unusual, and that could perhaps be because it is quite a technical bill and there was a lot of contentious items in the bill. Generally, the House of Lords is where the substantive analysis takes place. People are appointed to the House of Lords typically for lifetime service towards the state, areas of particular expertise, and are kind of in there for life. Used to have hereditary peers, which are now for the most part dying out and not being replaced. But now we're getting kind of expert peers who have been appointed, and then some peers who are appointed for other reasons and cause scandals. But for the most part, it is seen as the House of Lords provides the more substantive review and edits to the legislation. Then the House of Commons will have general debate over the suitability of a bill. So by starting the bill in the House of Lords, it could be seen by Labour as we're going to get all the tricky stuff out of the way first, and then in the House of Commons, where Labour is a supermajority, we'll pass the bill through quite quickly. Yeah, perfect. So we have mentioned a couple of times the prior attempted reforms of the GDPR, which was the Data Protection and Digital Information Bill. This was initially proposed by the Conservative Party in the prior government, and it was actually proposed 2 iterations of the Parliament ago. The Data Protection and Digital Information Bill, I thought, was quite important for us to address today, because quite simply, we did have 2.5 years of everyone talking about all the proposed changes. And these changes were quite attractive for companies because it was a lessening of the restrictions and it was a lessening of the compliance requirements that were being imposed upon, in particular, foreign firms, so firms not incorporated in the UK, in how they actually manage their compliance within the United Kingdom. So the Digital Protection Digital Information Bill proposed the removal of the data protection representative obligation. So if a company wasn't incorporated in the United Kingdom, you'd be obliged to have a local representative appointed to act as the liaison point with the data subjects, i.e. the individuals. So in our context, people participating in the trials, but also the site and study staff. A liaison with them, but also a liaison with the regulator, the Information Commissioner's Office. The DPDI also proposed the removing of the role of the Data Protection Officer, which would have been quite tragic for people such as myself and Damien, and a replacement of data protection impact assessments with assessments of high-risk processing. Just what are your thoughts there, Damien, on the replacement of data protection impact assessments with high-risk processing, particularly with clinical trials where we have sensitive data, and according to the European kind of approach, anything with sensitive data should be classified as high risk. But if we take a more kind of Atlantic view, and what I presume the Conservative Party were trying to interpret, high risk, they mean actual literal risk as opposed to just sensitive data being the criteria.
Yeah, I'm surprised to see it's still on the list of things to be removed or replaced, rather. I think if we think in practical terms for the life science industry, though, it's unusual to have a UK-only study. That's going to be a very small study. So in real terms, we're still going to be proceeding with DPIAs because there are going to be European countries, in most cases, involved in the studies. So for me, if you're doing the assessment to meet the European standards, I would probably still include the UK in that. However you want to define what high risk is, and yeah, there's different views on that. I think you're going to be doing it for Europe anyway. It probably makes sense to involve the UK or at least to reference it so that you're covering both bases.
Yeah, I agree. I also would imagine that the ethics committees have probably a more stringent view than perhaps the regulators, and they're going to look for what are kind of common standards in kind of the correct technical and organizational measures companies have to have, first in view of GCP and having good standards for research and ensuring that blind isn't going to be impacted and things like this, but also that, yeah, again, if you are processing information, how are you taking the steps to protect that? When we get onto the data use and access bill, we will actually see that there are bringing in other kind of assessments that we have to kind of take into account. But yeah, it is an interesting aspect of the data use and access bill. But I would always go back to the European approach, which I think the ICO supports at the moment. We'll have to see if they change their view, which is if you have sensitive data and there is another factor identified in the EDPB guidelines. So if you have 2 criteria, then it is going to be high risk processing, regardless of, let's say, the actual literal risk of pseudonymized data impacting a data subject if it's lost. If we consider, let's say, the realistic real life impact of a data subject whose pseudonymized information and then one piece of kind of health data getting accessed in a data breach, but it's a data breach which is internal from the site and the CRO. If we're being frank, the actual risk for the individual is quite low. The risk for the trial itself, of course, could be high. There could be an impact on the study, but yeah, the impact on the privacy of the individual, I would suggest is not that severe. So it is an interesting approach that they're taking here, but I do think the ultimate impact on us on a day-to-day might not be so significant.
I think the problem for me with replacing the DPIA, for me, it comes right back to fundamentals. Why do we do what we do? And I genuinely don't believe that data protection law is there to stop people processing data. It's to make people think about it beforehand and make sure they treat it appropriately. A DPIA is a great way of thinking about your study and your processing before you even start doing it. And pseudonymization is a mitigation. Everything you're doing is to mitigate against potential disaster without wanting to dramatize it, right? So for me, an assessment where you document the measures you do have in place, you make sure everyone's trained, everyone understands it. It's not particularly expensive in terms of time, effort, resources. It's something that has a useful purpose. I think it's a little blinker just to remove it and to consider changing the definitions of high-risk processing, because there is so much value in there, particularly as you touched on, it's sensitive data, it's large organizations that are often not UK based. I think for me, it's just a very logical, rational thing to make sure that you're complying. And the DPIA allows you to do that and to demonstrate that. So if you're ever inspected, it's very quick and easy to show that you've at least thought about it ahead of time. They might not agree with you, but at least you've thought about it and you can demonstrate that rather than scrambling to pick up pieces later.
Yeah, no, of course. And again, if it is somewhat similar, let's say, to in Europe, we have the transfer impact assessment, and in the UK, we have a transfer risk assessment. In practice, it's the same thing. It's a changing of the terminology involved. And again, yes, if you're running a trial in the UK, in all likelihood, you will be having one or two sites in Europe, or maybe not in the early phases, but certainly in the later phase trials. And to give an example of how important DPIAs are in some countries, in France, you have the MR001, where you, in essence, have to have a DPIA completed before you start. Well, before you start, everyone should have it done before they start, but you must have it done at the trial application process. And in Ireland as well, they also want to see during the clinical trial application that you do have your DPIA already prepared and your risk assessment completed. Two other aspects that the DPDI removed, but the Data Use and Access Bill did not, was the removal of the records of processing. So at the moment in the United Kingdom, if you're a smaller company under 250 individuals in a headcount, you only need to have ROPA for the activities which involve sensitive data or high-risk data. The DPDI was going to change that to things that actually resulted in, let's say, literal risk. So kind of removing some of the need to keep a record of processing, but not entirely. The impact of that, I would suggest, isn't that high realistically, because the records processing isn't too, it's tedious to do it for the very first time if you have a company who's never created those records, but the maintenance of the records is relatively quite straightforward, and you just periodically just ensure that all the records are there and they represent the accurate kind of tellings of what's going on. But the other aspect was, which was removed in the DPDI, but Data Use and Access Bill did not remove it, was vexatious requests or subject access requests. Normally in clinical trials, we're not actually going to get them, if at all. They're very, very infrequent. However, I think when they do pop up, it will be in kind of things like a managed access program, if the program was suddenly pulled, or if there was adverse events within a study, within a trial, and the individuals involved, of course, want to get all their information. So even having kind of just the get out of jail clause by saying it's a vexatious request, it wouldn't really stand up to any kind of credence in clinical trials. So it wasn't really something that was going to impact us on a kind of in a practical sense. I realize that we're kind of dwelling a lot on the early slides, so I'll try and speed up a little bit just to move on to the next slide, which is just the current progress through Parliament and through the Houses. So as I've said earlier, we did start in the House of Lords, which is peculiar, and it's now presently in the House of Commons. Without suggesting that our MPs, that our elected representatives, are unskilled or kind of untested, I would say they're not probably the best people to go through line by line and give a substantive debate, in particular because there will be a party whip particularly on the Labour side, driving things forward and saying we need to get this done because it is part of our 10-year plan. I'll talk about the 10-year plan in later slides, but it's an interesting kind of wording from the Labour Party. The amendments that did occur in the House of Lords was the scientific research definition was narrowed a little bit further, and it now includes a public interest test amendment. There was enhanced children's data protection. They addressed sex data reliability in the NHS. It's kind of a contentious political issue, maybe perhaps, but I would struggle to suggest it's going to impact any trial unless you're doing something with hormones, perhaps. They added in AI and copyright rules, and something that will affect most people in the UK, but not really impactfully, is they banned the cookie paywall pop-ups. So certain newspapers, kind of the more salacious and kind of red top newspapers, have been basically asking you to pay or accept their cookies. So they will now be banned come May, June, when the law becomes an act. House of Commons, there's been no amendments as of yet. I would suggest that there won't be any, and I would imagine that the bill will become a law May, maybe early June. So we can go on to the next slides. So getting to kind of the more important things for us today, the definition of research and what is the purpose of actually defining research in the UK definitions of the GDPR. So the GDPR has in Article 4 a list of definitions. This amendment to the GDPR through the Data Use and Access Bill adds in this Section 2, references to scientific research within this act, or within the bill, which will become an act, will now refer to and now mean any research carried out in public interest in a commercial or non-commercial activity. What do you think, Damien, would be the actual benefit, like the tangible benefit of defining research? Is there anything that, have we been curtailed in any way by not having research defined? Or were we challenged in any way by saying, are we struggling to justify this activity as research in the context of a trial?
Yeah, well, in the early days of the EU GDPR, I mean, it's changed now. We're several years in. We've got lots of EDPB guidance, other areas around clinical research, life sciences. In the early days, there was a lot of feedback that actually the clinical trial space hadn't been, in life science, scientific research space hadn't been truly considered and hadn't been invited to give thoughts into the GDPR as it was built out. Sort of pieces, I mean, GDPR by definition is general, right? It's not specific to an industry. Sort of pieces that didn't apply, couldn't work, needed to be thought through a little bit more. And the law didn't cover that. That was through guidance issued later. So over time, we've built up this collection of guidance, which allows our industry to function within this space and to understand how it applies, how to interpret it. So I think if we'd had a more, I mean, this is quite a broad definition now, but if we'd had a more clear-cut definition of what scientific research meant, it would have made it a lot easier to work within the space and to understand there are some things that need to be exemptions, that there are some things where it must be mandatory for our industry. But we didn't have that level of understanding. I actually think it's a positive thing to have a greater definition, a stronger definition, so that we know where we stand as an industry and how we fit into this process.
Yeah, no, I fully agree. And I thought it was interesting as well, the House of Lords felt that it was necessary to put in the public interest test for this research definition. I kind of struggle to rationalize why they thought there was going to be some scientific research that might not be in the public interest. If we have to go before ethics committees for approval anyway, then realistically it's always going to be in the public interest for research, at least in our field. Maybe some anthropology or kind of contentious research in universities, maybe that's when it'll pop up and they'll try to curtail things there. But I don't think the amendments the House of Lords proposed will actually impact us. So I think we can kind of move on to just discussing then the consent definition and how this has changed. So I've highlighted here in blue the most important points from our perspective, at least in research. So at the time consent is sought, it's not possible to identify fully the purposes for which data is likely to be processed. This, I think, has two kind of benefits for us. One is ultimately, if we do want to publish data, if there is kind of unusual or peculiar findings in the study, or there's kind of incidental data which we have discovered, and then the researchers say, oh, actually, this could spin out quite easily into a different field, completely unrelated to the original purpose of collection. It's really broadening what sponsors can do with the data, because they've been given kind of a consent to, and it will touch on legitimate interest for research versus consent for research. But what I would imagine here is that on the patient information sheets on the ICFs, we'll have a consent to any general future research. And then we have this kind of definition which will allow us, or allow the sponsors, to use that consent to basically go beyond what they would be allowed to in Europe, as long as the ethics committees approve of that research. And then that kind of ties into part D, where I've highlighted that the data subject is given the opportunity to consent to only parts of it. So they're not, and that'll tie in with the legal basis for research in the UK, which we would normally always recommend legitimate interests, and then having this second separate bit as consent to any general future or incidental research.
Yeah, I think it's a good thing on the whole. I think in terms of scientific research, having that broader consent piece, I think the key thing for me is the transparency with the data subject. So the individual consenting actually understands that they are consenting, and it is this broad consent. And if they don't want that to happen in future, they have to actually withdraw that consent. As long as this is all transparent, I think it's reasonable.
That's where we'll fall into
the question mark.
That's where we'll fall into issues with the HRA wording, which is not perhaps the most transparent at all. But moving on to the purpose limitation, there are two kind of very interesting things here, which are quite unique and do diverge quite significantly from the GDPR. One is generally when you collect with a purpose. So we say that we're collecting this data for XYZ study on XYZ drug under a specific legal basis. You can't really do any further activity that is not in line with that original purpose. This now changes if there has been a change of the controller. So if the controller changes, whether it is a secondary collection or touching on, which we'll touch on a little bit later, with the kind of the reforms of the NHS and NHS datasets, if you're a secondary recipient under Article 14 of the GDPR, then the purpose limitation on the original collection will not apply. What do you think would be the impact on sponsors of pharmaceutical companies here? Do you think it would actually trigger a lot of kind of investment or M&A projects for companies? Would they find it easier to monetize their research, or things that weren't, let's say, very valuable in developing their particular topic of drug, but perhaps might be of value elsewhere? Do you think that's going to encourage a lot more investment and opportunities in the UK?
I think it's an opportunity. I'm not yet totally convinced if we're going to see this big change or not. So I think it allows the opportunity that people could start looking at their data in that way. So if a big pharmaceutical company's run a study, got all this data available, someone else has a similar interest, but maybe a slightly different view, or it failed with the pharma that had it originally, I think there could be an interest to monetize that data at that point and say, look, we've got all this data, sell it across to them. I don't know, if I'm completely honest, Ed. I don't know which direction companies will go, because there's also this is our data, we own this is our IP. There's that. It's an old school pharmaceutical mindset, I know, but there is this is ours, we want to hold it. So I think the opportunity is there, but I'm not sure if companies would necessarily step to that point of selling their data and making it available to other potential competitors.
Yeah. Well, we'll see. Maybe once the rules change, it might become a booming market. The other aspect, which was interesting with the purpose limitation, was if you did not put into your ICF or your notice to the participants of a purpose, such as we're going to secure it in this way, we're going to anonymize it or pseudonymize it, normally you would have to go back to the data subject and inform them, actually, at the end of this trial, all your information is going to be anonymized rather than deleted, or all your information now will be destroyed rather than anonymized. So the purpose limitation and the kind of any requirements to notify or to ensure that the data subject is aware no longer applies as long as you're complying with Article 5 of the GDPR, so basically the security of processing. So anytime that we want to do a processing activity basically to ensure the security of data, we'll no longer have to go back to the data subjects and basically notify them or get their kind of acknowledgement that they've been informed that we are applying these security measures. So it really is kind of a practical choice. It shouldn't affect us too much because in practice we should have notified all the data subjects from the outset of this, but it may pop up in the instances where there has been that passing of data from one controller to the other and they have a different rationale and different purpose for the processing. Which then brings us on to kind of the final significant change, I think, in kind of communication to the data subject, which is notices. So this is changes to Article 13 and 14, the information to be provided. And it perhaps is with this that the HRA has already kind of prepared their transparency wording that information provided to the data subject should be provided at the point of collection, or if it's secondary data, within a reasonable time frame, normally within a month. However, which is something which is quite interesting for us, particularly if we're running clinical trials that are decentralized, or if the trial has occurred in kind of over a period of years and you're trying to get in contact with previous data subjects to get them to reconsent or to get further information from them. We're going to analyze their data in unenvisaged circumstances at the start of the study. We now will no longer have to do it if it's going to represent a disproportionate effort to contact the data subjects. So I'm not sure, Damien, if you've ever had instances where one of your clients, one of your studies, they wanted to contact the data subjects again. Either there was a failure of the ICF from the very outset that didn't properly account for something, and you were being instructed to provide all this information again to the data subject. And how could you manage the contacting of individuals after a 3-year period when all their information was pseudonymized from the outset?
Yeah, it has come up a few times across different clients, actually. I mean, the example you gave of future use there, that when they didn't foresee needing to use this data for anything else at the beginning, it's been years, the study's closed for years. Even situations actually where the study was maybe started under the old Data Protection Directive rather than GDPR, and so they didn't have the same requirement, so that they were missing information in the ICF, which was preventing them processing the data at this point in time. And it was a disproportionate effort. I mean, we're not talking about a study that finished yesterday. We're talking a study that finished 5 years ago. Those individuals might not be at that hospital working with that doctor anymore. They might have lost contact. I mean, the number of subjects that are lost to contact during follow-up of an actual ongoing study, it's even harder 5 years later. It just wasn't reasonable or possible to contact all those individuals. In some cases, we've found ways around that so that we could move forward. But in a few cases, we had to say, we're not going to be able to do this. We can't proceed with what you're planning to do. So I think this is a good idea. It does give freedom to be able to actually process data and use data that's been used. It does expand that remit. And I do think that you're still trying to be honourable to the data subjects, because you can still share a notice on a website or something like that. Okay, so they may not know to go and check it every 5 minutes, but the information is there if someone wants to find out what's happening with their data.
Yeah, I can imagine the click-through rate for company privacy policies and notices is not it's not the highest of any criteria. But
I think it's you and me, Ed.
yeah, they do call out the compliance mechanisms for doing this would be a legitimate interest assessment, which we have to do anyway, but also making the information publicly available, which would in essence basically on the sponsor's website having a distinct page for XYZ study. We're now doing this with your data. If you are part of this trial, part of this study, please contact us for further information or to instruct us to stop. So quite a practical change an approach that is being proposed at least in the UK. They have brought in two significant kind of safeguards for research, um, which are they should not cause substantial damage or substantial distress to a data subject, and that we have to ensure respect for the principles of data minimization. The ensuring respect, well, ensure technical and organizational measures for the purpose of ensuring respect for data for the principle of data minimization. I feel the second one was kind of not strictly necessary because you have to adhere to the general principles of the GDPR anyway. So whether or not you have a technical and organizational measure, it should be already in there through design by default that we respect the principles of data minimization. What I can imagine is they're trying to curtail the collecting of huge amounts of data for future research, and you should at least try and be targeted to a degree that, oh, this information we think will pose some interest to us in the future, rather than just collecting everything ad nauseum and creating massive data sets. But for the first one, must not cause substantial damage or distress to the data subject. It's hard to understand whether they're trying to propose a new sort of impact assessment or what do they actually mean, because how often is it that research, so research archiving or statistical purposes, will actually cause substantial damage or distress to an individual? Um, I'm struggling to understand how pharmaceutical companies are going to have to demonstrate this compliance, and whether it will be just covered by pre-existing legitimate interest assessments, which do balance the rights of the individual when a company proceeds with the study.
And I also wonder with this first one here, if they're actually referring to data breaches and demonstrating you have sufficient measures in place to prevent data breaches. Because although it's referring to processing it, it's talking about damages to an individual. So yeah, like you, I was kind of struggling with where exactly would that occur in the RAS space they're talking about. All I can imagine is a data breach where someone's got access to the information via a system. I mean, we're all aware of hacking, cybersecurity, etc. So I'm wondering if it's kind of a nod in that direction to make sure they have measures in place. For me, this line's open to interpretation. But I think as data protection professionals, I think we'd always be advising life science companies, research companies, to make sure they have measures in place. It's all about the individual's data. And actually, I think in our industry, companies are very aware and conscious of what they hold is precious and that we have to look after it. It's not just about complying with data protection. It's making sure the data is treated right according to GXP and all the other regulations that we abide by.
Yeah, it could also, we'll discuss in a little bit the substantial or damage and distress. We're going to briefly touch on the 23andMe data breach, which would actually lead to that substantial damage and distress. But yeah, moving on to the next slide, which is probably the kind of the most far-reaching in potential. Although we can't actually envisage what that potential is going to be for the moment, we'd have to refer to party manifestos, which are not renowned for being a clear vision for the future. It's more kind of general promises to get elected, and then let's see what happens. So basically, in the Labour Party manifesto, they proposed creating a national data library to bring together all existing research programs in the United Kingdom, which big achievement, and also deliver data-driven public services and ensuring kind of a common baseline, which we'll get onto in the next slide, but having a common baseline for all IT services within the NHS and within various government departments and administrative bodies to allow for the quick access of information. They were probably kind of inspired by the trusted research environments which were brought about at the start of COVID, where they kind of really allowed for very locked down, pseudonymized access to huge amounts of COVID data that pharmaceutical companies were able to log into and get access into all this pseudonymized information, where all the security measures were taken into account on the NHS side, as opposed to the pharma companies having to adapt these security measures. So what I kind of am reading from Labour's manifesto here is that's what they want to bring into place, and probably suggested by the NHS, because the NHS saw that as a massive success story. But again, this is a party manifesto. It's not, even within the data use and access bill, they prescribe how the NHS is to have various standards and formats, but they don't actually say what they are. They say that they're going to be provided by private companies. So presumably the likes of Microsoft, Amazon, Azure, and things like this will be the ones who will win the contract. And again, Labour says this is within the 10-year plan. So on to the next slide, we'll just see what they actually propose. So Windows XP for professionals. I'm not sure if you've been into any local hospital recently, but quite often you will see some computers are still running Windows XP. What the government are proposing is to basically bring online the entire health sector with the following kind of level of functionality, connectivity, interoperability, portability, common storage and access mechanisms, and common security mechanisms throughout the entirety of the NHS, the entirety of the HRA, and also within the research universities and hospitals as well, to envisage the National Data Library and allow for research, basically secondary research on the entirety of the NHS dataset. It's a lofty goal. I'm not entirely sure how achievable it will be. Perhaps within the 10-year span. But for the past year or so, we've had the post office crisis, the Horizon scandal, which was a IT system failure brought about by the government. It will be hard to see how it works, but if it does work, what do you think the benefit for research would be, that we have such a huge data set coming from the NHS, where pharmaceutical companies will be able to get easy access, and all the security measures are taking place on the NHS side, on the HRA side, as opposed to the pharmaceutical side?
Yeah, honestly, if they can achieve this, this is massive. This is absolutely huge. I kind of like you, I share some reservations. I'm normally quite optimistic. I'm a little bit pessimistic on this one, whether they can actually drive this through and achieve it. They've started making some changes already, right? So we saw NHS England is going. That's now going to be incorporated back into government. So they're centralising sort of control and management of the NHS. I suspect this is linked to having this consolidated, harmonised, standardised approach, and hopefully release of funds that they can actually put money into doing this properly. But if they can achieve it, I mean, let's take an example of a huge phase 3 study, but we have to have placebo for some of those patients. If some of those patients are terminally ill, there is an ethical, moral question. I get the scientific need for a placebo to test the drug, to have a control group. But from an ethical, moral point of view, you're putting people on a trial with no hope of a benefit because they're on placebo. Potentially this data removes that need for a placebo in the trial. If you've got that volume of data, you can essentially create an artificial control group. Potentially that means that everyone that's participating in the trial is on the drug, device, whatever it is you might be testing. And so there's a benefit to every single person. Potentially it means that you don't need so many individuals involved in the trial because you've removed that placebo arm. So lower cost for sponsors. So yeah, it could have a massive, and there's other uses as well. I know we're running out of time, so I'll stick to this one. But there's potentially a massive benefit to anyone involved in research being able to access this data. One word of caution would be obviously individuals' data in there. We need to make sure it's properly protected in there, used appropriately. And even you referenced COVID apps, even the COVID apps had data breaches at various points in time. They weren't fully secured. There is a word of caution in there, but if they're able to achieve this, and that's a massive if, this would be a huge advantage, I think.
Yeah, I think we'll gloss over this slide because it's really just poking fun at Rachel Reeves' cost analysis. But yeah, so kind of the next couple of slides we can gloss over as well a little bit. So the data use and access bill basically does want to empower the ICO. So we have been kind of poking and prodding the ICO throughout the entire LinkedIn Live, but it probably has been seen as a weak point by the government. They have proposed significant changes to the ICO, and it probably stings a little because ICO is the only regulator in the entirety of Europe that actually collects a fee. Now, perhaps it's their collecting a fee has driven the lack of impetus to levy fines because they have money coming in anyway. But the data use and access bill basically enhances the enforcement powers. So now the ICO can basically have compulsory information notices, which is the demand for information as soon as possible, which is where you'd have to provide your records of processing, your data protection impact assessments, and all this off the bat within very quick fashion, kind of within a day or two of getting the request. But now the ICO is going to be able to compel individuals, not just companies, to come and plead their case. So what we will see is that DPOs, or the data managers council of the firm, will be and could be summoned by the ICO to represent the company in person. They've also brought in urgent enforcement powers, which remove the preliminary notice requirement, which we'll touch on in a second on the 23andMe issue. They've also been given proactive powers, so they can initiate investigations without a complaint. I actually was a little bit surprised by that. I kind of thought that the ICO should be proactively searching and proactively enforcing the law as opposed to waiting for complaints. But then again, it makes sense because I've submitted complaints personally to ICO, and they've replied to me that we'll get to it in about 14 weeks. So if they're that kind of under pressure with the complaints, there's not a hope that they were going to do proactive work. The next change is significant just from the aspect of the adequacy decision with Europe, is that they'll now be subject to direction from the Secretary of State. So they'll no longer be an independent body, but rather the Secretary of State will be able to direct them. We think this is an area of focus. You need to focus everything on this, or perhaps, which would be more worryingly, all this on a specific company or a specific target. Again, the likelihood of this popping up in clinical trials, I would suggest, is probably negligible. It will be focused on the tech firms, probably Twitter, X, realistically. But yeah, and then the final change would be the removal of the commissioner, so it'll become a corporate body similar to Ofcom and the other regulators. The picture on the left there is from a organization called Open Rights Group. They monitor and look after data protection and plead kind of privacy rights within the UK. So they're quite a good follow. So the data use and access bill, just this week, ICO announced a kind of an action on 23andMe. So 23andMe suffered a major data breach back in 2023. The data breach occurred 6 months previously and was then discovered by 23andMe in September. Yeah. Where's the? I'm getting it. Okay, I think it's fixed. Yeah, perfect. So, yeah. Again, just to give an example how lackadaisical ICO is, 23andMe were notified of the breach in September, and then they notified the regulator not within the 72 hours as obligated to, but the following month. That was in October 2023. ICO just this month have issued a preliminary notice and fine of £4.5 million to 23andMe I don't think that's sufficient. And also, they did stress at the end of their wording that they're bringing into affordability considerations. Frankly, affordability considerations in the fine should not really take any sort of precedent at all. 23andMe have just actually played bankruptcy, and they've gone for Chapter 11, and they weren't accepted. So they will be selling their entire data set of information, which is probably valueless, really, because 7 million persons' entire genomic history was leaked already. So the information's out there. It's just an example of how ICO really isn't that kind of an aggressive regulator, I would suggest. I'm not sure if you think, Damien, the changes proposed, perhaps the preliminary notice, the removal of that kind of requirement might impact the kind of the efficiency of ICO or the aggressiveness.
Yeah, actually, I think the removal of the commissioner will be a big factor here as well. The ICO has been traditionally very heavily steered by its commissioner, and we've had some that are great and some not so great. Obviously, I think we've made it clear our views on the current commissioner. It's not been the best time as an information commissioner. I think it could have been a lot better. There's a lot of reprimands, no real action taken. I think by moving it into having a C-suite that guides it, and it's multiple people, and I actually think the guidance from the Secretary of State regarding certain areas to focus on is going to be positive as well. It does raise the question, obviously, about independence, but I think having that steering, that drive to actually take action, it's lovely they've given the ICO new measures and new things that they can put in place, but they already had powers and they weren't using them. So for me, it's important that with these changes, they now start using their powers.
So I realize we've hit the end of time, but we only have one final slide. So I think we can touch the final slide quite quickly. What is the impact of the Data Use and Access Bill, and could it lead to an end of the adequacy decision with the GDPR? So the European Commission awards adequacy decisions to various countries throughout the world that the European Union deems has an equivalent level of data protection. Even though the UK GDPR was, for all intents and purposes, up until now, the exact same as the GDPR, Europe deemed that the UK would be given a 2-year adequacy decision. This in itself was a bit of a snub, because Article 97 of the GDPR says at least every 4 years. So it could have been perhaps a bit of a kind of a French Francophone approach of perfidious Albion. We can't really trust what the British government are going to do. But the adequacy decision was up for renewal this coming June, and the European Commission have instead decided to extend it for another 6 months until the end of the year. So it's quite obvious that they are going to look at the impact of the change of legislation and then realistically make a political decision, because the risks posed, at least from, if we believe the European Commission when they say they analyze foreign legislations, the biggest bit is kind of surveillance and security services accessing data. The UK security services have gained huge powers under the Data Use and Access Bill. They will no longer have to consider the legitimate expectations of the general populace when they're accessing data. But more importantly, they will no longer have to keep a record of why they access specific bits of data and under what reason. So basically, they're being given a carte blanche and asked to pinky promise will only do it when it's necessary. If they don't keep a record, then they probably won't do it properly, if we're being frank. Now, the European Commission, they had the exact same fault with the US and US security services, and that's what led, well, the European Commission said the US was adequate, and you had activist lawyers, Max Schrems being a prime example, got it overturned. What is likely to happen, I would imagine there'll be a political decision. It depends how well Keir Starmer kind of sways the Europeans over the next 6 months, and whether we get an adequacy decision out of that, or if there's an issue, will there be kind of the cancellation of adequacy decision and all the consequences that follow? I'm really on the fence. I think in principle they should remove the adequacy decision, because it is breaking what the European Commission outlines as their red lines. But in practice, and I think you differ, Damien, you think that it will be more of a political and pragmatic solution.
I believe so, yeah, and I'm very conscious we've run out of time. So I just very quickly give my view. I mean, I do remain optimistic that we will retain the adequacy decision. I think there's a political need for it from both the UK side and the European side, and there's so much data crossing that border. I think it would make life very difficult for a lot of people if that adequacy decision was to be removed. And I think both sides of the UK and the EU are both aware of that, both have an interest in maintaining it. But I won't go into more detail at this stage. Maybe we need to do a separate LinkedIn Live for the adequacy decision.
Sure. So I'm not sure if there was any questions, Rogelio, or if we're completely out of time. I suppose if there was questions, we can just reply in writing, unless we'll do live questions. But
yeah, I believe we're out of time at this point, so we will respond to questions afterwards. We know who's asked what questions, and we'll try and respond to those. Feel free to contact us if you have other questions. It's MyData-TRUST. Contact at MyData-TRUST.com, or you can find us on our website MyData-TRUST.com.
Perfect.
Thank you very much.